At Revelier, we work closely with our customers who rely on our technology, rely on our services for record retrieval, coding, and the evidence selection for their audit submissions. Payment year 2019 is in process now. And based on our experience supporting multiple plans, I'd like to share some risks to avoid and best practices to consider. And the first being, don't lean too heavy on AI. I think we all recognize, Nadeem did a great job of articulating that the right AI NLP assisted coding solution can certainly improve efficiency and help coders navigate reviews more quickly. And a good AI-driven first pass review of charts will make sure and help coders ensure that no HCCs are overlooked. However, decisions regarding evidence strength must be made by experienced coders, not an AI tool. AI should use to assist, not make the decisions. Also, failing to retain documentation is a significant compliance risk. CMS does not recognize record retention issues as a valid hardship. The requirement to maintain records for 10 years is clearly outlined in MAO contracts. It applies to providers. So hopefully those charts for dates of service all the way back to 2018 won't be difficult to obtain. We hope, right? Also, don't skip data reconciliations. Timelines are aggressive, right? But delivering it quickly and discovering that you've missed an enrollee, you've missed an audited HCC late in the process can pose significant risks that are best to be avoided. Equally important is visibility into how reviews are impacting your enrollee risk scores to avoid any surprises. Nobody wants surprises, right? So it's really important to reconcile your inputs, your coding results, your outputs to your EDL every step along the way. And avoid the risk of approaching an audit project as solely a coding effort. Without a clear upfront plan for how you're going to manage attestations, how you're going to select medical records for each enrollee, you will likely face unexpected delays and challenges if you don't anticipate and plan for that up front. And identification and net new HCCs is critical in that selection. CMS has communicated they will factor new diagnosis codes that are substantiated into the risk score used in error extrapolation. So these are all very important risks and surprises that can surface that are important to anticipate up front and manage accordingly.